Varicose veins are enlarged, twisted veins that are usually visible under the skin in the legs. Generally, varicose vein disease is not a serious condition, but neglecting some types of varicose veins might cause open wounds at the ankle or clot in the enlarged veins. The cause is unknown, but genetic tendency is probably the most important factor. There are no specifically proven preventive measures, but there are various types of successful varicose vein treatment modalities. One-way valves in the legs prevent backwards flow during the flow to the heart. When the valves in the superficial veins do not work, the blood leaks downwards, causing varicosities. And in some cases, skin changes or ulceration in advanced cases. There are various types of varicose veins. In some patients, there are visible varicosities, and the ultrasound examination reveals a leakage of blood down to the ankle through the enlarged superficial vein called long or short saphenous vein. If the patient does not have pain, cosmetic concern, or no skin discoloration at the ankle level, there is no clear indication for treatment. If the patient has skin discoloration, surgical treatment is indicated even if the patient does not have any symptoms. In many cases, there are visible varicosities without leakage in the superficial venous system. In this group of patients, the reason for treatment always cosmetic, and usually we use sclerotherapy in those patients. Vascular ultrasound examinations called duplex is performed at the time of clinical evaluation of patients with varicose veins, and the information obtained from duplex scanning is important to select the type of treatment. The results of duplex scanning is dependent on the experience of vascular surgeon. If there is a leakage on ultrasound and there is indication for treatment, cosmetic and or medical, we choose either radiofrequency ablation or chemical ablations called VenaSeal. And in rare instances, we perform ultrasound-guided minimal exploration and modified removal of saphenous vein through a tiny incision. Phlebectomy and or foam sclerotherapy is also used during above-mentioned procedures for treatment of visible various types of varicosities. There are no single treatment that suits all patients. With proper planning, we try to treat all varicosities at the same time. Simple local anesthesia is used for glue or radiofrequency ablation. We do not use laser ablation anymore. Radiofrequency ablation is a minimally invasive treatment for varicose veins. This technique uses radiofrequency energy to heat up and damage the wall inside the vein. This usually closes off a varicose vein in the leg. And radiofrequency energy is directed through a thin tube catheter inserted through a small incision in the vein using local anesthesia. After treatment, compression stocking is used for only 1 or 2 weeks. The most recent innovation in the treatment of varicose veins is the use of medical glue known as VenaSeal, cyanoacrylate, to physically shut down and seal the main defective vein. VenaSeal is a safe medical glue that is used to shut the main saphenous vein in the thigh. Once the vein has been glued shut, it will undergo a process hardening and will be gradually absorbed by the body. The procedure is very safe and minimally invasive, performed under local anesthesia. The procedure involves the placement of a very small amount of VenaSeal medical glue into the vein through a small catheter. Unlike other treatments, VenaSeal does not require large volumes of local anesthesia. Patients can return to their normal activities right after the treatment. Sclerotherapy is commonly used for cosmetic treatment of varicose veins. We inject a special chemical fluid in foam form into a varicose vein to damage and scar the inside lining of the vein. This causes the vein to close and become invisible. After the injection of sclerosant is given, pressure is applied over the veins to prevent filling of the treated veins. Compression stocking is used for 1 week to maintain the pressure. The results are very satisfactory in about 80% of patients, and usually multiple sessions are required. We prefer phlebectomy when the size and the extent of varicosities are too large for foam sclerotherapy. This is performed under local anesthesia or very mild sedation, and mini incisions like 1 or 2 millimeters are used to remove the varicosities, and the patients return to normal activities immediately after the procedure, and compression stockings is used for only a week. The results are very satisfactory. The results are very satisfactory following all various treatments, and it is crucial to choose right treatment modality.